Sophie? Isn't it Sophie?
No, it's Ali.
Alicia.
Yes, Alicia.
Hi, Colin. Hi, Beatrice.
Good
Hi,
morning.
how are you?
I'm good. How are you guys?
Yes, we're well, thank you.
I missed you the other week. How are you?
I had 2 weeks in hospital.
Yeah. So did you go back into hospital?
No, they kept me there for the whole 2 weeks.
Okay. And how's your knee? I remember I saw you, I think maybe nearly a week or a bit ago, and you were just doing the upper body exercises.
That's correct.
So is that still happening?
Yes.
All right. So I'll give you some changes for today's session.
Thank you.
And you'll just do it seated, won't you?
Beg your pardon?
You'll just be seated the whole time?
Yes. Yes.
And how are you, Beatrice?
I'm well, thank you.
Good. Did you guys come to the Tuesday session this week?
Yes, I did, didn't I?
Yeah.
Yes, I
Did
did.
you have
no.
any-
You got caught out with the Ian's call. I think.
Oh, so I may have missed some of it.
That's all right. Did you have any questions about anything that you saw?
No, I think we did well.
Okay.
Yeah.
All right. Well, we will get started with today's session, and if Sabina joins us, we'll see her through. So, as always, we'll start with a bit of education first, and then we'll get into the exercise part. With the education component today, we're talking all things cardiovascular health, which is just a fancy term for heart health. So we're going to be talking about blood pressure. So blood pressure, just, I guess the definition for that is just the pressure that's exerted onto the walls of the blood vessels. And so our blood pressure is just typically displayed as 2 numbers. I guess the average, or what we consider the normal range for blood pressure, is under 120 for the top number, and then under 80. So that's typically around normal blood pressure. The top number, 120, or whatever the number is called our systolic blood pressure. And that's just when the blood vessels are contracting and pushing blood from the heart out to the body, so to our muscles, to whatever organs may need the blood. And then the bottom number, what we call is the diastolic blood pressure. That's when the blood vessels are relaxing and allows the heart to fill up with blood. So when the blood's returning back to the heart. So that's what those 2 numbers mean. As always, if you have any questions, just yell out. So the guidelines for blood pressure, these have been updated since 2017. I think it's the last time they're updated, from the Australian Heart Association. Got a little table here, and it's just showing us the normal ranges that we should expect blood pressure to be in. So I'll just read them out. So normal, as I said, systolic, so the top number is less than 120, and the bottom number, diastolic, is less than 80. When it's elevated, so for example, when we've just walked up a really tough hill, or we've come to one of these EVO classes, you might find that your blood pressure is elevated. So it could be between 120 and 129 for the top number, so a little bit higher. And then the bottom number is still less than 80. So it's really just the top number that's moving, because that, again, that top number is when the blood vessels are contracting and pushing the blood from the heart to our organs, to our muscles. So it makes sense. High blood pressure, what we call hypertension, stage 1, is when your blood pressure is sitting at 130 to 139, so anywhere in that range for the top number. And then the bottom number is between 80 and 89, and that can be just at resting. So compared to the normal, that is a bit of a jump by about 10 milligrams. And so it makes sense that when we're sitting down, our blood pressure should be low and should be under that normal category. So being diagnosed with hypertension stage 1, that's when your blood pressure, even at resting, is still quite high. And then hypertension stage 2, again, we're just moving up with the numbers. So it's 140 or higher for the systolic, the top number, and then 90 or higher for the bottom number. And then hypertensive crisis, so this is when you need to see your doctor immediately, is when that top number is higher than 180. That is just sending off some alarm bells, something you should definitely be feeling that something is wrong and you need to see your doctor immediately. So the top number is higher than 180 or the bottom number is higher than 120. So that's quite a jump from the normal, which is less than 120 and less than 80.
Bottom number 120.
Do you remember what your blood pressure was, Colin? Have you taken it recently?
No, not recently, not since I came out of hospital.
That's good.
What was it?
Have you guys ever been diagnosed with any hypertension or high blood pressure?
Yes, I have.
Yes, so it sounded familiar.
It sounds very familiar.
So it's kind of making sense now. It does make it a bit easier if you can relate to it or if you've heard these terms before. So hypertension is just a term given when blood pressure is high or elevated beyond what is what we term normal blood pressure or healthy blood pressure. Hypertension is a risk factor for many health conditions, including heart attack, heart disease, stroke, type 2 diabetes, and kidney disease. So when we do get diagnosed with hypertension, there are a few things that we can do to mitigate those risk factors. So it's just important to know, I guess, what that diagnosis means and then what you can do about it to prevent it from turning into a few other things. What causes hypertension? Does anyone know? Beatrice, Colin, do we have a guess at what causes that?
Strain and the stress.
Strain and stress. We also can be diagnosed with hypertension. It's a fancy big word. It's called atherosclerosis, which is just, again, a big word to say the arteries have thickened and tightened, and there's a buildup of plaque. So if you imagine a normal blood vessel is about this size, with that atherosclerosis, it's just the walls are thickening and it's making that area smaller and smaller for the blood to go through. So the blood is elevated, the pressure is increased and it has to work a little bit harder. The heart has to work harder to pump that blood out, hence why your blood pressure has gone up. That can be caused because fat is deposited onto the walls of the arteries from high levels of fat, sugar, or salt from the diet, as well as cholesterol. So again, that's a lifestyle factor. That's something that you can change just by changing your diet and eating a little bit healthier or watching the levels that you're putting into your body. So fat then becomes hard and forms a plaque around the walls, which then causes the passage of blood to pass through to become smaller, hence that increase in blood pressure that I mentioned. And again, the heart has to work harder to pump blood through. So I'll show you a little diagram here, and this is just of our arteries. So that's a normal cut of an artery. It's quite wide, an opening. Here, you might be able to see a small tear in the artery wall. And then here you can see that there's fatty material is deposited. So if we compare that to the normal, it's quite wide. That is quite a small opening for the blood to pass through. And that again is a narrowed artery, becomes blocked by a blood clot. So there's a little blood clot right there. But again, those are just some diagrams. So when a partial obstruction occurs, people may experience angina. Do we know what that word is, angina? That can just be chest pain. So that's the term for chest pain that we use, angina. So when a complete obstruction occurs, people may experience a heart attack. So plaque may also break off a wall and travel to other areas of the body and cause obstructions elsewhere. So that is possible. And for example, if this occurs in the brain, that's what we call a stroke, when those plaques have just a little piece has come off and it's lodged somewhere else. So how do we maintain optimal blood pressure? Again, as I talked about before, we can mitigate this risk through lifestyle factors. So one of them we talked about is a healthy diet. So limit that high fat, high sugar, high salt diet. Regular physical activity. Keep attending these EVO classes twice a week. You're doing well. Or just, your regular walks throughout the day. The heart is a muscle that needs to be exerted or worked to adapt and grow stronger. So we need to make sure that, we're exercising the heart, getting that heart rate up. Safe alcohol consumption, so no more than, does anyone know how many standard drinks a week we should be having?
I thought it was 2.
2 or 3.
I think it's 2 a day, so no more than 10 standard drinks a week.
Oh, no.
Oh, we, yeah.
So that is roughly equates to no more than 2 a day. All right, so another lifestyle factor is to limit or quit smoking. As you said before, Colin, limit your stress management. So just being able to monitor the areas in your life that you find stressful and finding ways to either alleviate that stress or work around it, and lower your cholesterol, which can be either, again, through your diet or through medication and seeing your GP. Another area to focus on lifestyle factors would be weight loss. So again, watching how much weight we put on if it's around our organs, and medication. So some individuals experience blood pressure due to genetic family history, so they need to be on medication because that is just through their, as I said, family history. All right, that is our education component out of the way. So we will start with our warm up and then we'll get into the main exercise. Today is all about the heart, so we're going to get that heart rate up, that blood pressure up. We're going to start with our stretches and our warm up. So I'll get myself ready. All right, as always, can we do our breathing stretch? So even while you're seated, Colin, hands come up, big breath in, and breathing out, arms come down. So big breath in through your nose, and out through your mouth. Good, taking your time here, sinking in your breath with this movement. One more, big breath in. And breath out. All right, from here, we're going to cross our arms over our shoulders and do our thoracic rotations. Looking over our left shoulder, breathing out, coming back to the middle, looking over our right shoulder, and back to the middle. Good. We're going to do this one just a few more times. So trying just to move your upper body, trying to keep your hips stable and just twisting your shoulders. All right, from there, we're going to do just our marching on the spot. Colin, are you able to just march your feet while you're seated?
Yes.
Yeah, great. Now just starting to get that blood flowing through our body. As we're marching on the spot, can we tap forward with one heel? And Colin, you're right to just keep marching on the spot, lifting those knees, lifting those feet. Good, Beatrice. Keep marching and then just tapping in front of you with your heel. All right, from there, we're going to go into our arm circles. So arms come out to the side, and we're going to start with small circles. And Beatrice, while you're standing, you can take a step to the right and a step to the left. You can add in a little step as you spin. Good, Colin, keep those arms going. Good. Can we start going backwards with our arm spins? All right, standing still for me, Beatrice. We're going to focus on getting these circles wider and wider until we make really big circles as wide as you can go. And remember, we don't want any pain or any tension in the shoulders. So just going through your range of motion. And can we go the other way? So changing direction, making those big circles. One more. All right. Shoulders, arms by your side, and we'll go into our shoulder roll. So rolling your shoulders backwards. Yep, lifting shoulders up, pushing them back and down. All right, can we go forwards with our shoulder rolls, rolling them forwards now.
One, just one.
All right, just shaking your arms out there. So we'll get into the first exercise, which is our body weight squats. So Beatrice, for this one, you can either squat in the air, and we're looking for fast but controlled squats, or if you feel comfortable, you can use your chair, practice our sit to stands. And we're trying to go for speed again, but controlled movement. So you've got two options there. Colin, for this one, because you can't use your legs, we're going to turn it into an upper body exercise. So for you, can you grab your dumbbells, and we'll focus on our bicep curls. So while you're seated, just having your weights by your side, focus on lifting that weight up to your shoulders and back down.
Yep.
And not letting that weight fall, but controlling it on the way down. Sound good?
Good.
All right. All right, so we are going to do this one for 40 seconds. So I'll just get my timer up. All right, are we ready? We're going to go in 3, 2, 1. Off we go. We're going to see how many we can do in 40 seconds. Good, you guys are doing awesome. All right, that's halfway, keep it up. So after this, we're going to have 20 seconds rest, and then we're going to go straight into the next exercise. Beatrice, that'll just be walking on the spot for us. And Colin, you can go back to your marching seated. Good, guys, last bit. 3, 2, 1, have a break. So we're going to have a break for 20 seconds. So we're giving ourselves short breaks so that our heart rate stays high. Beatrice, our next exercise is walking on the spot. Colin, again, yours will be seated, just marching on the spot, lifting your feet up. We're going to go in 3, 2, 1, marching on the spot. Beatrice, if you want, you can hold on to a chair, a wall, and you're just trying to lift those knees up. And Colin, just doing your best seated marching. So after we do 40 seconds, we're about halfway. We're going to have another 20-second break. Our next exercise, Beatrice, will be our wall push-ups. Colin, you'll grab a band and you'll do it seated, pushing out. So keep going. We've got last 3, 2, 1. So Beatrice, finding your wall, we're going to do our wall push-ups. Colin, if you've got your band or if you've got dumbbells, you can push them out and still do that same motion. So we've got 5 seconds. All right, 3, 2, 1, off we go. Doing this for 40 seconds, guys. Colin, did you choose the weights or the band?
The band this time.
All right. So you'll notice that we're doing short rest breaks this time. So again, working on that heart health, making that heart pump our blood through our body to our muscles. All right, 10 seconds left. Keep going, guys. Good, 3, 2, and 1. So have a quick break. Colin, your next one, grabbing your dumbbells, you're going to be doing some seated boxing, so punching out in front, just like this for 40 seconds. Beatrice, we're going to be doing some star jumps. So that's going to be, you can step out to each side with your arms up. So 3, 2, 1, off we go. So Beatrice stepping out and trying to do this one as fast as you can. And Colin, you're doing those dumbbell punches.
Yep.
Good. Good. Keep it up, guys. Our next exercise after this will be our walking on the spot or walking seated marching. All right, 10 seconds, keep going. And 3, 2, 1, have a break. If you need to have a drink, always have a drink whenever you need it. Our next one, as I said, will be our walking on the spot or seated marching. So we've got just 10 seconds, so take a bit of a breath here. All right, in 3, 2, 1, off we go. You can have your hands on your hips, you can hold onto the wall. Just marching on the spot, keeping that heart rate up. Good, guys, keep going there. Great, past halfway. Got about 10 seconds left. And then our next exercise will be with the dumbbells. So we'll grab our dumbbells in 3, 2, 1. All right, grabbing your weights. We're going to be doing a bicep curl here. All right, so having a break. We're going to go in 3, 2, 1. Off we go. Bicep curl up and down. So after this exercise, we've got one more. We're going back to the walking or seated marching, and then we're going to have a break. So we've just got one more exercise to do, and then we finished our first round. We're going to do that all again. Good, last 10 seconds, keep going. We've got 4, 3, 2, and 1. Dumbbells down. Our last one will be that marching on the spot. So we've got 20 seconds rest. We're going to go into our marching. After our marching is finished, we're going to grab a drink of water. So we're going in 5, 4, 3, 2, 1. Let's go. Marching on the spot. Great, you guys are doing awesome. We'll do one more round of this and then we'll go into our cool down stretches. All right, past halfway, keep it up. And last 10 seconds, keep going. 3, 2, 1. All right, grabbing a drink of water, have a quick break, and then we'll go and do that all again. So if you need a quick drink, make sure you grab one.
Another drink. I'll finish mine.
I finished 2. Should I take them both out and get another one?
Okay.
Colin, how did you go with those exercises?
Yeah, quite okay.
Oh, good. Let me know if there's anything that you don't feel comfortable doing or if there's anything that's painful or you just want to change. I'll add in something else.
You right? Oh, thank you.
All right, so did we feel our heart rate going up then?
Did yours go up?
I don't know. That's like, no, it's harder.
Did you feel like you were breathing a little bit harder and you were working?
Yes, I probably was.
Okay, good. So we're gonna do that all over again. So when you guys are ready, we're gonna start with our squats that we did, Beatrice. So again, you can do it standing, you can do it seated on a chair. Colin, for you, I think we did our bicep curls, but because you're doing a few of them, another exercise you could do is raising your arms out to the side with holding the dumbbells.
Okay.
So going up to your shoulders, or you can do it out in front. So you've got two options, but I don't want you going higher than your shoulders. So you've got that. Beatrice, Colin, I'll get the timer started and then we'll go. So we'll start again. Beatrice, as I said, with the squats, Colin with the raises in 3, 2, 1, off we go. So remember, we're working hard, trying to go as fast as we can, but in a controlled manner. Great, guys, keep it up. We're halfway. So Colin, you can raise in front now. Both arms in front, and you're working different muscles. Great, last 5 seconds. 4, 3, 2, 1. Have a break. Colin, you should be feeling that in your shoulders. Our next exercise will be the walking on the spot. So you'll notice this is throughout. Colin, seated marching. So you've got 10 seconds here.
That was harder going out to the front than to the side.
Was it? All right,
Yeah.
going to marching. Marching on the spot. Which one was harder, the sideways?
No,
Out to the side?
yeah.
Ah. Yeah, it's a tough one, isn't it? And you don't need very heavy weights. You just need light weights and you'll feel it straight away.
That's right.
All right, we're past halfway, guys. Keep it going. Keep that marching. Our next exercise will be our wall push-ups, Beatrice. Colin, you'll be grabbing that Pharaoh band, so making sure that's ready. We've got another 5 seconds here, so you've got time in 3, 2, 1. All right, Beatrice, finding your wall. Colin's got the band around him. All right, just 10 seconds here, so making sure you're ready, in position. All right, in 3, 2, 1, off we go for 40 seconds. Great, so getting that chest all the way down or bending your elbows and then making sure your arms are straight as you push up. Past halfway. Good, guys, keep going, last few seconds. In 3, 2, 1, have a break, coming back to the middle. All right, from there, again, we're going straight into the walking or seated marching on the spot. So give yourselves a bit of breather. We've got 10 seconds here. All right, 3, 2, 1, off we go. So seeing if you can march a little bit quicker this time, trying to get that heart rate up. Our next exercise, Beatrice, will be our star jumps where we step to the side and step back. And Colin, I think you did your boxing here. Good, so keep going, guys. We've got our last 10 seconds. Trying to march as fast as you can on the spot. Getting your heart rate up. In 3, 2, 1. All right, Beatrice, we'll be doing our step together, step together. Colin, grabbing your dumbbells. You're going to be doing your punches out in front for 40 seconds. All right, in 3, 2, 1. All right, off we go. Good, so Beatrice, we're going as fast as we can, and we're going to get that heart rate up. Nice, Colin. keep going. And 3, 2, 1, have a break. Our next exercise will be our walking, and then we've got 2 more exercises and we're done. So getting ready for our walking on the slopes, keeping that heart rate up, keeping our blood pumping. We're going to go in 5, 4, 3, 2, 1. Off we go. So after this set, we're going to be going into our bicep curls. So we'll grab our dumbbells, then we'll have a break, and then we'll finish off with some marching, some walking on the spot, and then we'll go into our stretches. Great, guys, halfway. Keep it up. All right, in 3, 2, 1, have a break. Grabbing your dumbbells, we're going to go into our bicep curls. So holding your weight by your side. We're going to be curling that weight up to our shoulders and back down. We've got in 3, 2, 1, let's go. Curling that weight up and controlling it back down. So again, you're trying to do as many as you can in 40 seconds. Great, guys, keep going. All right, 10 seconds left, keep it up, as many as you can. 3, 2, 1, dumbbells down. And our last exercise to finish us off will be our walking on the spot. And we'll do that in a few seconds. So I've got 10 seconds break, and then we're nearly done. Getting ready in 3, 2, 1, let's finish it off. Doing our fast marching on the spot, getting those knees up. Right, guys, past halfway. Last little bit. And 3, 2, 1, all done. All right, just to cool us down, we're going to finish up with some stretches. And then if you have any questions, you can ask me. We're going to go do our arm stretch to start off with. So can we cross one arm across our body? Bring the other arm up like a clock and pull your arm to your chest. So pulling it in. Big deep breaths in through your nose, out through your mouth. All right, can we do the other side? So bring your arms down, one arm across your body, one arm coming up, pulling your arms close in. All right, back down. All right, for this next one, can we do our thoracic rotation? So twisting over our left shoulder, back to the middle, twisting over our right shoulder. When you twist over your shoulder, big breath in, twist, and big breath out as you come back to the middle. So focus on your breathing and try and bring it back down to normal. Try and control your breathing and match it to the movement. Good, we'll do one more each way. So take your time, back to the middle, twisting that. All right, arms by your side. Can we do our breathing stretch? Big breath in. Stretching up to the sky, stretch your spine, and big breath out. Out through the mouth. Big breath in through your nose. And out through your mouth. I'm going to do 3 more. Good, 2 more. Last one. All right, sitting down, Beatrice, we're going to do our hamstring stretch to finish off. So, sitting down, one leg bent, one leg straight out. Hands on top of each other and sliding down. As soon as you start to feel that hamstring stretch, holding there. Take a few deep breaths and see if you can go a little bit further or see if you can hold it in that position. All right, other leg for me, sitting back up.
Have you put up one?
Other leg out in front, hands on top of each other. Big breath in and breathe out, slide down your leg. As soon as you start to feel it, you might find one side is tighter than the other. All right, sitting up. All right, guys, that is our EVO session done for the week. They'll be on again next week, same time, same place. If you have any questions, feel free to yell out. Otherwise, see you next Tuesday.
Thank you.
No.
See you next Tuesday.
Bye, guys.
Bye.
Bye.